Yes, it's getting recorded. So in this lecture about antibiotics, we will see the drugs what we are going to use for bacterial effect for any infection or any condition that might be developed because of bacteria. So we will see some antibiotics and the complications, the introduction of antibiotics, and the things what we may be using, the mechanism of action, a brief mechanism of action, how they are acting, and what causes antibiotic resistance, prevention of antibiotic resistance, and how we can prevent the antibiotic to get resistance to our patients, and antibiotic prophylaxis. So these are the different things we are going to discuss in antibiotics. So basically, the antibiotics are the drugs which are used for microbial, for bacteria, for infection. Basically, why it's used for infection? Because they are the effect of antibiotics. What we have seen here is it shows antimicrobial effect. It shows what effect? Antimicrobial effect. So here the antimicrobial effect in antibiotics will be showing by two different manners. So here the drug, any antibiotic, what it can do, it can, so by one method, like one here, the first one, it stops the growth. It stops the GRO. It stops the growth or multiplication, means multiplication of the bacteria. What do you mean by multiplication of the growth? Here I mean multiplication by one bacteria will be divided into two, okay, and this two bacteria will get divided into four, and this four bacteria, okay, are getting divided into, say, example 8, and so on. Okay, this is how the number of bacteria, okay, the pathogens is getting developed in the body, and they're causing infection, and they're causing infections. So here there are antibiotics that's stopping, that inhibiting the multiplication of this type of bacteria. And the second one is the antibiotics that will kill the bacteria, that will stop the growth, okay, that will kill the bacteria. So here the antibiotic which stops the multiplication or the growth, it is something called bacteriostatic, and the antibiotic that kills means, okay, where the eradication of bacteria by some mean, by the cell wall or maybe some other complication that might arises developed in the bacteria, and that is something called bactericidal. So this is stopping multiplication static, and then killing them, it is like bactericidal. Okay, so now we'll come back. So which one is our PPT? This. Okay. So here antibiotics are the type of antimicrobial agents used specially for against bacteria, used specially against bacteria. And there are medicines used to prevent or treat bacterial infection or certain parasite infection. And these are the antibiotics which is used to prevent and to stop or to treat the some infections, and they are not active against infection caused by virus and fungi. Okay, it is not effective against virus or fungi. And they are determined by microorganisms, naturally entity, and three synthetically produced sulfonamides, fluoroquinolones, and oxazolinidones. So these are the three different type of bacteria, which is something derived from natural entity or synthetically produced. So here, what we discussed just now, the mechanism of action of this antibiotics is like, as we discussed, it shows two different effects. So one is something where it is, this is little bit, okay. One is something where it suppresses the growth of bacteria, that is something, or growth or multiplication of the bacteria, that is something bacteriostatic, and killing the infectious bacteria, that is something bactericidal, that is something bactericidal. So we'll see individually what is bactericidal and what is bacteriostatic. Agent that prevent the bacterial cell growth or replication means what it is doing here. Bacteriostatic means it is stopping the growth of the bacteria, means the development in the bacteria will be inhibited. And but where and or by replication. Replication means multiplication of the bacteria. Number of bacteria multiplication will be inhibited. Okay, not necessarily killing them. The duration of this therapy must be sufficient to allow the host defense mechanism to eradicate the bacteria. Upon the removal of bacteriostatics, the bacteria usually starts growing back again. Okay, but whereas in the case of bactericidal antibiotic, the drug which is showing the bactericidal type of effect, here the agent that induce bacterial cell death means the bacteria will be dead. The bacterial cell death would take place. And here the examples are bacteriostatic and bactericidal drugs like chloramphenicol, erythromycin, clarithromycin, aminoglycoside, beta-lactamase, vancomycin, etc., etc. So these are the example of the drugs which is like bactericidal and bacteriostatics. So based upon the mechanism of action on which part, we'll see how they are getting, how we are getting differentiated. Based upon the which site or the which area of the bacterial cell it is acting, the effect will be varies. Clinically, situation in the bactericidal action is considered necessary in endocarditis, meningitis, and osteomyelitis. Or what is bactericidal? Here, the bacteria is bactericidal antibiotic that kills the bacteria, and then the inhibition, how it's killing the bacteria by inhibiting the cell wall synthesis or inhibiting the bacterial enzyme or by bacterial protein transportation, by bacterial protein transportation, okay, or by bacterial enzyme, and here by the bacterial cell wall synthesis, inhibiting bacterial cell wall synthesis. We have a figure here. Yes, we have a figure. We have a figure in. So what do you mean by bacterial cell wall synthesis? Means there is a cell wall at the outer layer of the bacterial cell. So what it is do, it will inhibit the growth of bacterial cell wall, and here inhibiting the bacterial enzyme and protein synthesis. So the drugs are the example are differs, like here beta-lactamase drug like penicillin derivatives, cephalosporins, monobactam, carbamazepine, vancomycin, and here the different drugs like fluoroquinolone, metronidazole. Metronidazole is something which is used in dentistry more, okay, for so many conditions, and you use penicillin and the derivative of penicillin like amoxicillin, ampicillin, okay. This is first class. You have to remember everything. Okay. So next is bacteriostatic. What do you mean bacteriostatic? So here, look here, you don't have to worry about what drug, we have to remember everything or which is bactericidal drugs. These are the drugs like whatever the drugs you are learning, we are giving example over here. These are the drugs you will be studying in upcoming classes. So like suppose example, when we say beta-lactamase antibiotic, we have a complete lecture of beta-lactamase, cephalosporin, fluoroquinolones, okay, metronidazole, okay, aerobic, anaerobic bacteria. So you are having different. Okay, you are reading this same drug like maybe 4 to 5 times I'm teaching you, okay, or maybe another doctor will be teaching you the same drug 4 to 5 times. So you will remember by itself like that. Tetracycline, what it is? It is, these are the drugs which stops protein synthesis. Okay, so all the protein synthesis type of drugs, it will be there. So you will repeat, these medications will be getting repeated in almost every lecture. So don't worry about from now. Okay, if you start learning from now, it will be easy for you. Okay, coming back to the lecture here. Bacteriostatic. What do you mean by bacteriostatic antibiotics? So these are the antibiotics that basically acting or interfering the protein synthesis, production of protein or replication of DNA or the aspect of bacterial cell wall metabolism. So we will see, so here this protein production, bacterial protein production or DNA replication. So we'll see the concept like here, the protein synthesis inhibition will be something like 50 S ribosome, 30 S ribosome, 70 S ribosome, okay, replication, transcription, transduction, etc., etc. stuff. You will be studying in upcoming classes in detail. So here the drugs are example like tetracycline, sulfonamides, trimethoprim, chlorophenicol, and macrolides. So here these macrolides means it's like erythromycin, clarithromycin, chlorophenicol. This is the drug which was the first antibiotic, synthetic antibiotic. Trimethoprim, sulfonamides is the third lecture you have. Tetracycline also you have a different lecture. They must work together with the immune system to remove the microorganisms. So here, how does these bacteriostatics are doing? They are stopping the replication and the multiplication by a process of DNA replication by inhibiting the protein synthesis or interfering in. What do you mean by interfering? What it is doing? It is inhibiting the protein synthesis in the bacterial cell wall, and that leads to the inhibition of multiplication. It stops the multiplication of bacteria. And mechanism. So here, based upon the bacteria, the drug antibiotic we are selecting, the antibiotic shows different mechanisms. Different class of drug shows different type of mechanism. There's some drugs like they inhibit the cell wall synthesis, like ampicillin, penicillin types of or penicillin derivatives. Alternatives of cell membrane integrity, inhibition of ribosomal protein synthesis, suppression of DNA synthesis, and inhibition of folic acid synthesis, folate reductase synthesis. So here, based upon this mechanism, the drugs are classified under different classes. Like here, the cell wall synthesis, the drug which is inhibiting the cell wall synthesis is beta-lactamase drug, okay, like beta-lactamase and vancomycin. So these are the drugs like penicillin, cephalosporin, etc. Folate synthesis, folic acid inhibition synthesis is called folate synthesis, sulfonamides, trimethoprim. Nucleic acid synthesis, DNA gyrase or RNA polymerase. So this is acting on DNA translocation. So here what we have seen here, DNA replication, affecting on DNA replication. Okay. And this protein synthesis, I told you like 30, we have discussed like proteins inhibiting the protein synthesis, like 30S acting on the 50 unit. And some drugs like polymyxin, this is something which is affecting on cell membrane area. So here, based upon the action, based upon the different action, different site of action, they are acting on the different area of the DNA, sorry, not DNA, but different area of the bacteria, they are classified under different classes based on their mechanism of action. And this, what are these mechanism? Extra cytoplasmic drug, like that is like mechanism where it inhibits the cell wall synthesis and the membrane effect, and intracytoplasmic drugs that is inhibiting the protein synthesis and DNA and folic acid synthesis. So extra or intra means outside or inside. So intra and extra, okay? Antibiotics showing the extra cytoplasmic effect are usually, but not always, bactericidal, but antibiotics showing intra cytoplasmic effect are usually bacteriostatic. So intra means the drug which is basically acting more outside is not always it is not always bactericidal. Means it will not always kill bacteria. Sometimes it can be bacteriostatic, but the drug which is acting intracytoplasmic means inside, okay, inside, intracytoplasmic drug always will be, it will be always bacteriostatic type of drug. And some bacteriostatic, and here there is a point to be remembered here, some bacteriostatics drug at high concentration become bactericidal. Everybody clear with this? So here the drugs which is showing the extra cytoplasmic effect, it is bactericidal. The drug which is showing intracycloplasmic effect is bacteriostatic always. But okay, in bacteriostatic, if suppose the drug with a higher concentration, or if we are increasing the dose, if we are increasing the dose up to a higher concentration, then the drug can show a bactericidal effect. The drug can show a bactericidal effect and higher concentration. The bacteriostatic drug in higher concentration shows bactericidal effect. The spectrum and the activity. So, and these antibiotics basically, generally it's divided into broad spectrum and narrow spectrum antibiotics. So based upon the disease condition and the usage of the antibiotics, these are broadly classified. Broad spectrum antibiotics are the agents that are widely used for broad spectrum means, as the name itself indicates, that can be used for more than one or more than two particular infections or two particular conditions. So here, that's why we say here, it's used for wide range of diseases causing bacteria. Whereas, okay, first we'll finish this. Used when a bacterial infection is suspected, but the group of bacteria is unknown, or when the infection with multiple groups of bacteria is suspected. Although the powerful poses specific risk, disrupt or native normal bacteria and development of antimicrobial resistance. So here is a broad spectrum antibacterial drug, and here why we give broad spectrum antibiotics. If suppose a person is having an infection and is having a multiple symptoms, or multiple, if we have a doubt, is suffering with multiple bacterial infection, in that case we will give a broad spectrum antibiotic. Or if suppose we don't know what particular bacteria is causing that particular infection, in that case we give broad spectrum antibiotic. Are you with me? Okay, clear. When we give broad spectrum antibiotic in the condition where, if the disease, the patient is suffering with, like suppose I'll give you one example. A patient is suffering with sepsis. So example, a patient met an accident and the patient is suffering with sepsis, some bacterial infection. And when we do the cell culture, when we do the report, what do you call, not cell culture, when we do the culture report means when we take the blood sample or the urine sample, till the time we find out what actual bacteria or the multiple bacteria is causing that particular infection. So till then, we will be giving a broad spectrum antibiotic to that particular patient, so as to avoid or to inhibit or to suppress that particular infection which is caused by that some bacteria. Okay, so that's why we use broad spectrum antibiotics. What do you mean by narrow spectrum antibiotic? The narrow spectrum is able to kill or inhibit the limited species of bacteria and allowed to kill only those bacterial species that are unwanted, are causing that particular disease or condition. Beneficial bacteria are unaffected and minimize the collateral damage effect of the microbiota. So here the beneficial bacteria will be unaffected. So here a narrow spectrum means it will be acting like, suppose if we know that a patient is suffering with a bacteria called E. coli. E. coli is a bacteria that causes some infection to the patient. In that case, we'll give this drug that is acting on E. coli bacteria, and that drug will not be having any other effect on the other bacteria. So example like that. Okay, so that is something comes under narrow spectrum antibiotic, narrow spectrum antibiotic. Okay, thank you very much. Next, pattern of antibiotic use and misuse. So here the use and misuse, this is the major area of concern. Like here, why we are stressing more about the antibiotics and why we should give or we should not give antibiotic to the patient. Okay, this is a big area of concern, and the world, not only everywhere in the world, the people are suffering with this complication. The problem is if the use of antibiotic is proper for a proper symptoms, then it is good. If it is used for a purpose, then with some condition, it's okay. If it is misused, then that is creating a lot of issue for everybody, for everyone. So here antibiotics are most widely abused. So that's why we use the term over here, abused prescribed drug on the basis of inappropriate indication, dosage, or the duration of use. So here, inappropriate indications means the indications are not proper, and if the indications are not proper, obviously the dosage form of a drug will be differs, and the duration time will also be differs. And approximately half of all antibiotic used in the hospital are given to patient without signs and symptoms of infection. So without signs and symptoms of infection, most of the half of the antibiotics will be given to the patient just like that. Then it is now the question arises how they can give just like that. So they may be suspecting something, or maybe they are trying to avoid and prevent it. Maybe they are taking some preventive measure. That's why they are giving this antibiotic. In hospital, the use of antibiotics. So here, this will clear your doubt. In hospital, if we see, 1/3 of antibiotic will be empirically, 1/3 will be prophylaxis, and 1/3 will be appropriate culture or sensitivity test. So here, based upon 1/3 of the antibiotic, like out of, say, suppose example, 10 prescriptions, 3 antibiotic prescription will be for empirical, 3 for maybe prophylaxis, and 3 for maybe based upon appropriate culture and the sensitivity test. Okay, why they are doing? They are not doing just like that. They will be doing, why? Prophylaxis means they are trying to stop any condition or the disease to come to that patient because they are suspecting something empirically, and there are some will be because of that, like say suppose they did some culture and they got some visit, and then they will be getting this. Phone, you. So as a part of this antibiotics, so this will be given in these 3 different forms. A part of this analgesic antibiotics, a part of analgesic antibiotic are the most common drug used by the dentist in their routine prescription. So here, in the case of dentistry, dentists use more analgesic because the patient complains about the pain, always complains about the pain, pain and inflammation, and because of that, the dentist prescribe more painkillers as well as more antibiotic. The next medicine is antibiotics when other than painkiller. Antibiotic resistance. What is antibiotic resistance? Antibiotic resistance is something which is produced by improper usage or the improper use of the medication. If the antibiotic is not used for a proper cause or it is misused, then in that case, the antibiotic resistance can be developed. So example is antibiotic resistance develop when the bacteria changes in response to the use of a drug antibiotic. It does not mean that the body become resistant to the antibiotic. It is something that the bacteria become resistant to the antibiotic that are designed to kill them. And here it can affect the people of any age or any rising dangerously in all over the world, and growing list of infection and such as like say example pneumonia, tuberculosis, gonorrhea, and foodborne disease. The condition like nausea, vomiting, or food poisoning, etc., are becoming harder or sometimes getting impossible to treat as antibiotic because of the antibiotics are becoming less effective. Why it is less effective? Because of excess use of this antibiotic, in different prior before this condition, then that is reducing the effect of this drug. So then the patient requires the higher, stronger antibiotics. Antibiotic resistance is most likely to occur in subtherapeutic dosage of the antibiotics are used, those that do not kill or inhibit the microorganisms, but rather allow it to preserve the chemical and threat for the survival and to react with developed resistance. And here, therefore, it's suggested that take the entire prescription of antibiotic regime rather than stopping the antibiotic when the patient is feeling well. So here, this is the most important point to be considered. Okay, sorry. This is the most important point to be considered. And antibiotic resistance lead to prolonged hospital stay and increase medical costs for, and the patient may get morbidity. So increased morbidity or mortality will be there. So staying in the hospital or death may can occur. So here, why the as resistance is developing, the one of the factor is likely occur subtherapeutic doses of antibiotic are used. Okay, instead of like stop, do not kill or inhibit the microorganisms. And here the another cause is stopping antibiotic. What happened? A patient comes to you and he says, complains that okay, he's having or she is having say example a dental infection. He is having some tooth with pus formation in his tooth, okay, in the gum, and because of that there is a lot of pain. So what you did, you say example, you prescribe that patient, him or her, amoxicillin and metronidazole. Amoxicillin 500 milligram 3 times a day, metronidazole 500 milligram twice a day, say example. BD, TID and BD, the two different drugs you have prescribed. And what happened after taking the medication, and you prescribe this medication for 5 days. You prescribe for the 5 days, say example. You prescribe for 5 days. And what happened? The patient starts getting better after in second day. He take the medication day 1, and in day 2 he is completely fine. The pain, inflammation, spurs, everything has been gone. Okay, and day 2, say example. And what the patient will do, think, okay, now I didn't have any infection or pain, now I don't feel any pain. The patient stop taking medication from day 3. Or maybe the patient will take on the day 3, he stops at like day 4 or day 5, say example. So what happened here? And again, after some time, the patient might develop again the same problem. And when we give the same medication to the patient, that medication will work or may not work. Why? Because of producing resistance. Am I clear? So this is how that antibiotic might cause resistance. So here the bacterial resistance will be caused by 3 or 4 different functions, different reasons how it can cause and bacterial resistance. So here these are the things, mechanisms that causes bacterial resistance is enzymatic action, modification of the protection of targeted site, alter the cell membrane permeability, and activate the drug reflex. And here enzymatic action inactivation is the most common form of bacterial resistance which is developed, most common form of bacterial resistance. So here example mechanism where the bacterial antibiotic resistance took place. Here the antibiotics are going inside and it is going and binding to the enzyme and there is no response. Okay, and here if you see the second part, the modification or the protein targeted site. So here at the protein targeted site over here in this area, modifying the drug target. So here the drug will go and it cannot bind to the receptor or it is modified, or maybe this area where the circle is. Okay, and altered cell membrane permeability. So here I think this is the cell membrane permeability. So here what happened, inhibiting the drug to get inside the cell. Why? Because if you see carefully, okay, if you see at this point, the cell wall over here and the cell wall over here little bit thicker, okay, little bit thicker. So here it is altering the cell membrane permeability. Okay, and here the next one is active drug efflux. What drug efflux? The drug will go inside the cell and then immediately after that it will come out by another pump that is called efflux pump. So drug activated by drug efflux. So here these are the few different ways how does the antibiotics in the bacterial cell wall, the antibiotic is getting resistance. And antibiotic resistance is one of the biggest threat to the global health, and the microorganisms multiply in the presence of antibiotics, and tolerant microorganisms start to grow after the antibiotic is removed also. And here another way, what is tolerance? The difference between the resistance versus tolerance. So here, if you see this figure, you will be understand very easily. So here the antibiotic which is going and binding to the targeted receptor, targeted site, and target is corrupted and the cell death. Okay, and the target means the bacterial cell is got death. So antibiotic bind to the target cell and alter the function and cell antibiotic working properly. But here in the case B, if you see the antibiotic coming and binding to the receptor in the bacterial cell, but it is not, say example, it is taking the process of efflux. The antibiotic come inside and it's going out. Okay, so example like that. So here what happened here, the similar way, antibiotic is coming and binding to the receptor, but it has moved out. Once it has moved out, it is called resistance. So that's why it altered the targeted site. The antibiotic failed to bind to the particular area or particular receptors, and resistance of the treatment has been. But here the another case here, the case C, in this case, the antibiotic come and bind to the receptor on the bacterial cell, and then even then it inhibits the antibiotic target, and that prevent the antibiotic for corrupting the function and resulting, that is something called resulting in tolerance. That is something called resulting in tolerance. This is something we are talking about, the resulting intolerance. Why? Because the drug is binded to the receptor, to the target site, but it causes some resistance. And because of that, the cell is altered and it is not properly showing function. Antibiotic resistance prevention control. How we can stop this antibiotic resistance? We stop misusing or overusage of antibiotics. So the antibiotic has to be used when it is necessary and has to be used properly and has to be given for a proper period of time. Okay, we should not use or overuse. Overuse means should not use whenever, oh, I think I have some infection, I will take amoxicillin. Not like that. Okay, poor infection prevention and control. In the case of poor infection, and the prevention control has to be taken. Steps can be taken to all level of society to reduce the impact or and the limit of spread resistance. Like individual, like every individual person has to take a responsibility to overcome this condition. So why here we say individual here? Because like once an individual will starts working on it, they slowly they will become more, and it will become a very big team. So use of antibiotic when prescribed. So whenever it is prescribed or whenever it is necessary, it has to be used on that time. Never demand the doctor for the antibiotic. So don't go and demand, okay, doctor, I think I have some problem, so give me antibiotic. It's not like that. That's not the right way. Preventing infection. How we can prevent infection? Like washing hands, sanitization, hygienic food, etc. stuff. Follow up the prescription. The prescription has to be followed properly, and never share or used or left over antibiotics. So here, like say suppose my brother or my sister or my father family, somebody has taken some antibiotic and there's some antibiotics are left. So, and now I think I have some problem, I will take those antibiotics. So that is not right. That is not basically really right. Antibiotic resistance by another is making a policy. Another method is making policymaker, educating the healthcare providers and the general public, and ensuring the robust national action plan to tackle the antibiotic resistance, improve the surveillance of antibiotic resistance infection, and strengthen the policies of the program implementations, regulate, promote appropriate disposal of medicines which is not used, quality medicines, and make information available to and impact antibiotic resistance. So we should make aware or make everybody feel, give proper information to everyone so that antibiotics should not be used whenever it is used when it's required, and this should make the patient self-aware that using antibiotic is not is an easy thing because that may lead to so many complications when they need a real need of an antibiotics. Okay, like what happened once uh, recently I have come across one case because of this antibiotic resistance. The patient has met an accident, and I know that person, and then I went to the hospital and to see him, and no antibiotic, like say suppose no amoxicillin, no penicillin, like he was on meperamine or something. Meperamine, I think meperamine, I think. This is one of the highest antibiotic which is available in the hospital, highest one. And then I think that one, or maybe something else, the next below that. Okay, I don't remember basically the name. So here, but like the doctor said him that like he was taking excess of self-medicated stuff. Maybe he's also a doctor, and then because of that, the some medications, maximum medications are he's resistant to maximum drugs. Basically, that guy was resistant to maximum drugs. So what does that mean? So here, that is nothing but improper or irregular use of a medication or a drug when it is not required. So that has caused him this problem. So that like that comes under individual person issue, and then a policymaker. Policymaker means like health professional. They we have to make the policy, and health professional. So this is your responsibility now. Okay, everyone's responsibility. What is health professional? Prevent infection by washing hands, sterilizing instrument. Okay, so we can sterilize the instruments and then wash hand, wear gloves, and do the things properly. Okay, like properly what we call sanitization. Okay, that stops infection spreading. Prescribe and dispense antibiotic only when needed according to the current guidelines. So based upon the guidelines. So here, that's why you might have seen in the hospital, the MOH, Ministry of Health, Ministry will always produce guidelines based upon the wind of infection or based upon the conditions, okay, on the complete kingdom or complete globally. So based upon that, the ministry will make the rules and they will provide that particular that rules and regulation list to every hospital or every dispensary, so they can follow that guideline to overcome this type of like resistance or the resistance issues. Educate the patient but about correct usage. So here educating the patient by about correct usage, resistance, and dangerous misuse of the antibiotic. So here, like here, I have told you the educating the patient not to take antibiotic, educating the patient. What do you mean by educate the patient? So here there is a confusion arises now. Let me tell you something. Okay, I'll give you one example. Okay, I'll open. Okay, whiteboard. How to rub this? I cannot rub. Yes, clear. Yes. Okay, clear. So here, okay. So what was that? Educating the patient. Like in what way we are educating the patient? So the first voice is low. Why? Okay. Where were you till now? Can you hear me properly now? Can you hear me now? Hello, 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 hello. Yes, 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 yes. Okay. So in what way we are educating the patients here? So here the patient education means, what do we mean by this? Here there is a person, there is a patient. Say suppose he is having some infection and you give him some medication, right? And you told him you have to take this medication 5 days, okay? And the drug is TID, okay? And you give him another drug like the drug 2. So drug 1 is 5 days and the drug 2 again it is 5 days and it is BD, okay? You give the drug, say example BD. And here, what do you mean by educating the patient properly? So here, we told him TID means with a gap of 8 hours. So example, what you said, when the patient comes to you, you said morning 8 o'clock, afternoon, say example 3 or 4 o'clock, and in the night, say example, you said 12 o'clock with an equal gap of 8 hours, right? And now what the patient did, okay, and BD means with a gap of 12 hours. So suppose 8 in the morning and 8 in the night, say example. So now what happened? What the patient did? So this is the TID is an antibiotic. So I will make it with the red. This changing color is also a problem here. Okay, so here this TID is antibiotic 8, 4, and 12. So what the patient did, what after says there's like many conditions. So one condition is the patient starts feeling better, say example after day 3, and you prescribe for after day 2 he's feeling better, at the day 3 he take the medication and he stopped the medication for day 4 and day 5. He's not taken medication for day 4 and day 5. So this is one of the method by it's causing resistance. And another method is the second method. Okay, he is not taking the medication on proper time. Like say suppose the patient wakes up in the morning, say suppose example 10 o'clock in the morning, 10 a.m. Okay, he has taken the medication at 12 o'clock in the night. He woke up in the 10, so he missed the dose of 8. He did breakfast and everything by 12. He take the tablet at 12, and immediately after that 12, at 4 o'clock, he remember that he has to take the medication at 4. He take the medication again at 4. And he want to go to somewhere, and he for to party or something, to the Bahar or say example. He's going outside with his friend, and he forgot to take his medication of the night. So no medication at all. So what happened here? So here the gap between the medication has been reduced, the antibiotics. So that may be one of the again factor. This factor. And here in the third case, what happened? The patient is taking medication for 5 days, but instead of taking 3 times a day, instead of taking TID, okay, what he's doing, sometimes he's taking 2 times, like in day 1, he takes only two dose. In day 2, he's taking 3 dose. And day 3, if he thinks day 3, he's taking 3 dose. And day 4, he take only 1 dose. And day 5, no medicine at all. Okay, so we have discussed like 3 conditions that is possibly that may lead to cause a more resistance issues in the patients when compared if suppose they will be followed a proper prescription regime what has been given to them. If they're not following the proper prescription regime, then this could be the condition that might arise. So these conditions may lead to the resistance. Okay, resistance means here we were back. Okay, vaccinate. Okay, here educating the patient. So this is what do we mean by the correct use. This is what we mean by the correct use of the drug for avoiding resistance. Report antibiotic resistance infection to the survey team. So if there is any antibiotic infection has been seen, then we have to report to the surveillance and talk to the patients about preventing infection, like say suppose how we can prevent infection. So now everybody say example, what we're doing, we are suffering with from last 1 or 2 years, we are suffering with COVID-19 issue. Yes. So what are the precautions we are doing? We are taking vaccinations. We are hand washing or sanitizing our hand, covering the nose, mouth, and sneezing. So these are the basic things what we tell to the patients when they are going in public place or gathering, or maybe in an infectious area, or maybe say example to the hospital, or where there is more prone to get infected. So in those areas, he has to do this type of things to prevent infection. And agriculture sector only given antibiotic to the animal under veterinary supervision. So here, why now the question arises, doctor, why this agriculture sector is important here? It's not we are dentists, we don't need it. Yes, you are a dentist or you're a doctor, you are pharmacist, you don't need it. But here, this is very important stuff. Like here, the reason because this is here the only given antibiotic to the animal under veterinary. So here, if the animal is suffering with some infection, in that case only the drug has to be given. Not use antibiotic for the growth promotion or prevent or the disease in healthy animals. So here, this is the point why. So there are so many ways, like suppose if the animal is not producing enough milk, okay, so there is a cow, okay, and the cow is giving, say, suppose example, 10 liters of milk in every day. But because of some condition, the cow has stopped reduce because the cow become old and she is giving 6 liters of milk, say example. Okay, so there are few medications, few drugs that can be given to the cow to increase the amount of milk what she was the animal was given. Okay, and in like generally the antibiotics are also used for the growth, like say suppose in the what do you call chickens. In chicken, they give so many antibiotic in the feed, and they give antibiotic directly to the small chicks so that they just grow up and looks heavier. Okay, and then how can we prevent this type of condition or the disease condition in the animal? By vaccinating the animal. If we give vaccine to the animal, the disease can be prevented. And promote a good, apply good practice in all the steps of production and processing food of animal from and plant sources. So we are promoting proper and the good production of animal and the plant sources production. Improve biosecurity in the farms and prevent infections. The last is prophylaxis. Okay. Oh, already we are 5 minutes late. Okay, we'll finish it. We have only 2 slides. Refer to the refer to the prevention of infection by antibiotic prior to the surgery of dental procedures. So here, what do you mean by prophylaxis? Means we are trying to prevent the infection. Okay, and here how we are preventing? To prevent metastatic bacteremia or to prevent the post surgical infection. To stop this post surgical infection or other issues, what we do, we give prophylaxis, antibiotic prophylaxis. So example, a patient has to be done uh, tooth extraction, right? So what you will say before, to if suppose the patient is diabetic or you think maybe the patient might get infection after the extraction, so you will say take 1 gram of amoxicillin before you come over here. So then like 2 hours, eat good, take 1 gram of amoxicillin and come, and then we'll extract the tooth. Okay, so why it is that is something comes under prophylaxis. This is to avoid the infection. Antibiotic chosen should be effective against the most likely microorganisms to cause infection. Cephalosporin remain the preferred drugs. And last one is the patient should be given prophylaxis if the medical condition of the patient is likely to be worsened after the surgery in post-operative infection. So here also there is a condition where we can give the drug only when it is we have a doubt the condition might go worst when after the surgery, so post-surgery. So because of that, in that case we'll give prophylaxis. Otherwise there is no need, and won't poses serious hazards or the chemic or the patient's recovery and well-being. Say example. So what is the example here? In the case of UTI surgery, UTI urinary tract infection surgery, in the case of pneumonia or in the case of local infection, may endanger the health of a patient after surgery. Antibiotic prophylaxis in surgery has proven to be effective. So in the case of surgery, if you are giving treatments, okay, if a patient undergoing surgery, the antibiotic prophylaxis is very much effective by avoiding patient suffering and saving life. Clear? So this is all about antibiotic prophylaxis. Uh, so here we have seen come across like almost we have seen a general introduction about antibiotics, and in the next time we will see particular about some antibiotics and what their class of drugs in detail, or not detail, we'll see briefly. Any doubts here? If anybody have any doubt or any question, you can please ask. Otherwise, you are free to go. Thank you very much.